Welcome to Skin Sync, the official podcast of Elevate-Derm Alliance, your trusted source for the latest in dermatology for PAs and NPs. Join our hosts for real clinician perspectives and expert guest insights as they explore everyday dermatology topics with practical takeaways.
Welcome to this episode of the Skin Sync podcast. We are so incredibly honored to be joined today by our guest, Dr. Tina Bhutani from UCSF. And Bucci's going to tell us a little bit about your background.
Dr. Bhutani is a dermatologist, clinical researcher, associate clinical professor at UCSF, international speaker, and CEO of Synergy Dermatology in San Francisco. Dr. Bhutani, welcome.
Thank you for having me. I'm so excited to be back.
So, we're actually really excited to talk to you today because you were at our Elevate Summer Conference back in July 2025, and you gave
Yeah.
a wonderful lecture called Wake Up Dermatology, and it was very well received. So, we wanted to kind of dive a little bit deeper today.
Your lecture resonated with so many of the attendees of our Elevate Dermatology conference out in Park City. So we really could not miss the opportunity to pick your brain and really ask you, why do you think sleep has suddenly taken center stage in health conversations? And we would love to hear about your background with sleep research.
Yeah. Well, thank you for allowing me to speak about this topic because it's truly something that I'm very passionate about. And I think those are both great questions. First of all, why are we all of a sudden interested in sleep, right? And I think I started off that lecture by talking about, how many of you are tracking your sleep with, your Apple Watch or your Aura Ring, or how many of you have like an app on your phone to help you get to sleep or something like that. Over the past probably 5 years, there's been this like resurgence in sleep, or people focusing on sleep, I should say. And I think, it's funny because in the past, it was the exact opposite. I think we didn't used to appreciate sleep as much. And in fact, there were sayings like, I can sleep when I'm dead, or, or we used to think about it like if you're prioritizing sleep, you're actually lazy. And I think that the world of sleep research really blossomed probably about 10 or 15 years ago. And our sleep medicine colleagues have taught us that actually sleep is quite critical. And there's so many critical functions that are happening during sleep that we should be prioritizing it. And I think that's now trickled down into popular culture. And that's why we're hearing so much more about it. And so actually I was inspired to study sleep by a patient of mine who's had really hard to treat psoriasis. He had really recalcitrant psoriasis. And no matter what I did, I like could never get his skin to get completely clear. And he one day came into my clinic and his skin looked great. And I was like, well, what are you doing? What are we doing differently? And he told me, he said that he stopped sleeping with his wife. And I was like, all right, well, that's interesting. So it turns out that his wife had been diagnosed with sleep apnea. And she started sleeping in a separate room because she was now going to have this large CPAP machine and she didn't want to, keep him up. But unbeknownst to her, like over the last 10 years, she had had sleep apnea this whole time, was waking up multiple times in the middle of the night, was also waking him up, and they just both hadn't realized what was going on. So when they started sleeping in separate rooms, he started actually getting sleep again without being woken up multiple times at night. And all of a sudden his psoriasis started to clear up. And he told me, he's like, you gotta study this. You gotta look into this. And at first I was just like, all right, well, this is interesting, but this is an N of one. And so I don't know if I can really
Right.
take this and run. But as I started to really, look into the literature, I started to learn one about how important sleep is for the immune system in both healthy individuals, but probably in patients also with, immune diseases like psoriasis and rheumatoid arthritis and Crohn's disease and, all of these other diseases we hear about. And then second was that chronic sleep disturbance, if you're chronically not sleeping well, is associated with a lot of comorbidities. And a lot of those comorbidities overlap with the comorbidities we talk about in psoriasis. So things like cardiovascular disease, diabetes, obesity, certain cancers. And so I started to wonder, like, why aren't we just studying this more, this relationship? It seems to be kind of this Venn diagram of diseases and comorbidities, but nobody has really looked into this. So that's kind of what inspired me to do this research and how it all started.
And I love that it was inspired by an actual patient who
Yeah,
you cared about, and it
Absolutely.
truly came from, your big, huge heart, and we've gotten to know you now over a couple of podcasts, and we just love that you are so passionate, but
yeah,
you are such a brilliant clinical researcher that you say, "Wait a minute, I need to study this. There's
yeah,
something here." Like,
yeah,
you
yeah,
definitely know.
exactly. I definitely saw that there was a gap, and I always say this, like, we can treat patients' skin, we can get their skin clear, we have tons of treatments, we have tons of medications, but really what the patients want is that, like, what else, right? That what else question. I always get that question from my patients. Their psoriasis is clear, and I'm, like, patting myself on the back. I'm like, "I've done it. I've, like, cured their disease." And then they come in and they ask me, they're like, "Well, what else should I be doing now?" Right? And that's the question we never know how to answer because we haven't
Right.
had the training in, how to counsel them on diet or exercise or physical activity, and so I felt like sleep was one area where maybe I could learn to counsel them and learn, it's something easy that I could approach and help them get better sleep, and maybe this could help their skin disease.
I love that. And before we dive into the dermatology side of things, you are a
Yeah,
part of the superhero sleep team called Dreams Team at UCSF, right?
yeah.
Can you tell us who's on this team? What do you guys all do together as far as sleep research goes?
Yeah, absolutely. So, myself and Dr. Wilson Liao, we're both the dermatologists on this team. And, we've worked together on psoriasis research for many, many years. So, again, when I started to dive deeper into this research, I said, okay, I went to Wilson and I was like, Wilson, I think we need to look into this more. And I showed him all the evidence, and he was like, I agree, go make it happen. And so then I started to look around and try to find people at UCSF who were doing sleep research. And the person whose name I found continuously on many different sleep studies was Eric Prather, who's a sleep researcher. He's actually a psychologist by training, but he does sleep medicine now. And he is a very prominent sleep researcher. He's done a lot of really cool studies. So I reached out to him, and he was intrigued. He was like, "This is super cool. We definitely need to study this more." And then he connected me with some of his other colleagues. Dr. Andy Crystal is another very prominent sleep researcher, psychiatrist, and sleep medicine doctor who is like everybody knows in the field. So it's nice to have him on your on your team. And then also Katie Stone, who has done a lot of research in large populations and looking at sleep in cohorts. And so I brought them all together, and we started this dreams team, we call it, and we're just finished actually our first study looking at sleep and psoriasis. And we put psoriasis patients in a sleep lab and also healthy patients in a sleep lab, and we're going to be comparing like their sleep patterns, their biomarkers. We drew blood. It's a very comprehensive study. So the first publication should be coming out pretty soon.
Exciting.
That's
Yeah.
fantastic. We cannot wait to hear the results of that study.
So let's kind of transition over to dermatology, right? So we see a lot of inflammatory diseases in dermatology. How does sleep impact specifically atopic and psoriasis? You kind of dug a little bit deep into your lecture about these two disorders. So give us some more information about that, please.
Sure. Yeah. So, I think it's quite obvious, especially for your atopic patients, but also for psoriasis. These patients, their skin is itchy, it's uncomfortable, it's painful. And we all know that most of those symptoms kind of are elevated at night, in the middle of the night, for a variety of reasons, probably. And so, I think it seems very obvious that these patients aren't sleeping because they're itchy and uncomfortable. But actually, as we are learning and as we're digging more into it, it actually goes beyond just those symptoms because there are some studies to show that even if you control for subjective symptoms and you look at patients' sleep, it's still not great. It's still not great. And so the question is, what else is going on? And there's a lot of research outside of dermatology in fields like rheumatology and gastroenterology, as I mentioned, that show that having an overactive immune response actually creates more fragmented sleep. But we don't exactly know how that happens. But when you look at levels of inflammatory markers and then follow people's sleep, it seems that inflammation kind of leads to poor sleep. And so, even if you get the patient's symptoms under control, we always talk about these diseases are diseases of systemic inflammation, right? They're not just skin diseases, they are, inflammatory diseases. And so, even if we can get their skin under control, they probably still have underlying inflammation under their skin. And that potentially is still leading to poor sleep. So, again, it's not just about treating the skin. We really do need to start thinking about these diseases more comprehensively.
So, what signs do you look for clinically that might suggest that a patient's skin disease might be intertwined with their sleep quality? And how can providers out there pick up on those cues? I mean, besides the obvious asking them how they're
Yeah.
sleeping,
Yeah.
or if their patterns have changed, but what do you look for specifically, or what should we start kind of alerting our antennas to?
Yeah. Yeah. So, I used to ask patients. So, first of all, looking at the interplay between inflammatory skin disease and sleep, I think is very hard because we don't know exactly what the connection is there just yet. So, I don't think you can like look at someone's skin necessarily and say like, oh, this person needs to be getting better sleep. We're not there yet. Hopefully, one day we will be. But I think it's a conversation that we probably should be having with a lot of our patients who are living with these skin diseases. And I know that seems overwhelming because I think we keep adding to the list of things to ask your patients, right? We're like, your psoriasis patients, you should be checking their blood pressure and checking their cholesterol.
Yeah.
And now I'm saying you should be asking them about their sleep. But I always remind people you don't have to always do this all in one visit, right? This is a chronic disease. We're going to be seeing these patients probably at least a couple times a year, maybe even more. And, each time they come in, maybe just try to tackle one thing, right? So, like today, I'm going to check your blood pressure. Today, I'm going to make sure that you have a primary care doctor and you're following with them and they're checking your cholesterol because I'm still not doing that, I'll be honest. And then, the next time, then maybe we can talk about sleep or, mental health or whatever it is. So I think it's just, don't feel the pressure that you have to do everything in one visit. Just kind of try to tackle each one of these things as you go. And when it comes to sleep, I think I used to ask people how many hours of sleep they get in the middle of the night. And I found that that question is quite elusive because just like my patient who like didn't realize he wasn't getting enough sleep, I think people don't realize they might think they're in bed for 8 hours, so they'll be like I get 8 hours of sleep, but the reality is they're probably tossing and turning, they're waking up multiple times, their sleep is not necessarily restorative. So I think the right question to ask patients, and this has come after a lot of practice, is to ask them if they feel well rested when they wake up in the morning. So, and that's the more critical piece because if they're not rested, even after getting, the 8 hours of sleep, we know that there's something wrong there. There's a disconnect. And so that's when you want to dig a little deeper. And so the first step I always say is, the kind of the sleep hygiene techniques we talk about. So, making sure, for example, like they're not looking at screens very close to bedtime. So, like an hour before bed, trying to shut off, all the screens because blue light can definitely kind of stimulate your brain to stay awake. Making sure the room is cool because, when your body is overheated, it makes it harder to sleep. Making sure, obviously, your bed is comfortable and, it's a place that you want to be and kind of optimizing that, decreasing caffeine later in the afternoon. If you're going to take naps, keeping them very short so that you're tired at the end of the day. If you're taking long naps, and you're probably not going to be sleepy at night. So little things like that. Like I have a little handout that I give to patients that are called like sleep hygiene. You can Google it. There's a list of very common things. And then if despite that they're still not feeling well rested, that's when I have them talk to their primary care doctors because they might need to actually get connected with a sleep doctor and make sure they don't have things like sleep apnea or leg syndrome. There are diagnosable sleep conditions. And so then they might need a little bit more help.
And I think one thing that I took away from your lecture that I think it's easy for us to kind of dismiss these questions in clinic, right? We're busy. I'm usually running at least 30 minutes behind every day. I don't want to
Yep.
ask another question. But one of the statements that you had in your lecture that I thought was actually fascinating was that for each hour increase in average nightly sleep, patients with
Mhm.
psoriasis have a 33% decrease in the odds of having a heart attack. By just
Yep.
having this conversation and bringing it to kind of that patient's awareness, we can reduce their chances of developing a heart attack. That's kind of wild to me.
Totally. Yeah. Because, at baseline, psoriasis patients, again, are increased risk of having cardiovascular disease and having heart attacks. And then the sleep disturbance independently also increases that risk. And then when you combine these risks together, you then, multiply their odds of, again, having these negative outcomes. So, again, just, taking that minute could be very critical for that patient.
Excellent. And I do want to rewind just for a moment about why, like, what's happening during sleep, right? What do we need sleep for? What is it that's happening with our immune systems? Can we kind of dig a little bit deeper into that?
Yeah, yeah. I mean, the science there is pretty complex. And again, I think we're still learning a lot about it. But, how I think about it very simply is that during sleep is kind of like when your immune system is resetting and refining itself. And so there's a lot of studies that show, for example, we talk about immune memory, like, being able to form immune memory so that, for example, when you're exposed to a bacteria or a virus or something like that, your immune system can respond very quickly. Most of that immune memory is being formed actually during sleep. So when they do the studies and they look at when these antigen presenting cells and memory T cells are the most active, is actually in the middle of the night when we're sleeping. So that's just one example of something that might be happening during sleep. We also know that during sleep, it's also a time when your brain is kind of like washing itself out. So I talk about it like running the dishwasher at night, but there's a lot of studies that show like oxidative like byproducts basically are being cleaned out of the brain actually in the middle of the night, and it's similar probably is happening with the immune system. We're kind of like clearing out all this like messy byproducts of like antibody degradation and T cells and things like that. So again, the immune system can kind of be optimal functioning in the morning. And so these are a lot of the things that we're seeing that are happening in the middle of the night when we're sleeping.
And you talked a lot in your lecture also about the consequences of insufficient sleep, both short
Mhm.
term consequences and then long term consequences. The longer it goes on, obviously, and the longer our immune system is struggling to perform and we don't clear those, metabolic waste, so to
Mhm.
speak.
Mhm.
Can you go into a little bit of short term versus long term?
Yeah, yeah. So the short term, I think, all of us can probably empathize to it, but things like emotional reactivity, right? Stress reactivity. So, like, if you haven't had a good, amount of sleep at night, you're going to be kind of a little on edge. You're going to be
Like a
pouring out
toddler. Yes.
to your friends,
And
probably.
so we
So
excuse every new mom out there because we've all been there. We know how that is.
And it's funny that you say that because at the time when that patient came in to talk to me about sleep, I was a new mom. Like I had just had my first baby. I had just come off of maternity leave. And so I think I was also more empathizing with him because of that. Now
Sure.
Yeah.
that I said it, I think you're
Yeah.
right. But yes, you're totally right. But yeah, so emotional reactivity, stress reactivity, we see that increasing. Interestingly, even short amounts of sleep actually make you make poorer decisions when it comes to, for example, the foods that you choose, the decisions that you make. And so the studies show like even if you were to like get 2 nights of poor sleep, you're like more likely to like choose like a burger with fries when you're faced with a menu rather than picking the salad. So it's like little things like that sleep is really important for in the short term. But in the long term, like you said, when you get that chronic sleep disturbance, so if we're chronically not sleeping well, that's where, we really start to see those issues. And that's where the comorbidities come in. So again, cardiovascular disease, we see more heart attacks. Patients are more likely to be obese. They're more likely to have diabetes. So again, that similar list of diseases that we talk about with diseases like psoriasis, we also see with chronic sleep disturbance.
So one thing that I find really resonates with patients is the word inflammation, right? And I think in your lecture you mentioned how when you're lacking sleep, it creates this pro-inflammatory state in the body. So maybe that's a good way for us to communicate that with our patients.
Yeah, yeah. So even if you don't have any diseases to start with, if you're not sleeping and we check your inflammatory markers in your blood, they're actually elevated compared to people who are sleeping well. And so, again, at baseline, chronic sleep disturbance is a pro inflammatory state. And then when we add in an inflammatory disease into that, right, then you can just imagine we're kind of compounding that inflammation and making it even worse.
This is something that affects all of us, right? In your lecture, you stated that, over a third of United States adults are not getting the recommended, 7+ hours of sleep. And
Yeah.
the disparities occur across all races, across all household incomes. It's definitely something that, we can certainly dive into and like you said, ask patients. But I loved that concise, do you feel rested
Mhm.
statement. It is a little daunting to ask providers to, add one more patient-oriented measure, one more questionnaire while you're waiting for me for 30 minutes, and
Right.
let me dive into 15, different questions.
What are some tips that you give to patients and to clinicians on how to improve their sleep quantity and quality?
Yeah, it's a great question. So there's a list of things that you can think about, and if you Google just like sleep hygiene techniques, they're called, you can find this list. I oftentimes have a handout for patients, but a few, important things that I think are, quick and easy to implement in clinic is one, making sure patients are kind of shutting down their screens about, an hour before bedtime. You want to make sure that blue light can kind of stimulate your brain, and so it can keep you awake longer. So making sure that they're shutting down their phones, your TVs, anything like an hour before. Just try to kind of prepare yourself for sleep. You want to make sure that you keep the room nice and cool, because if you're overheated, that can prevent you from sleeping, or you can wake up sweaty, and that's not great. So kind of keeping the room at a cool temperature, making sure they're wearing kind of lightweight cotton clothing, for example. One of my colleagues always says that the only two things that you want to do in your bed are sleep and sex. And so
I love
that's
that.
another
That's
thing you could
perfect.
tell your patient. Because again, you don't want your bed to be associated with anything other than sleep, right? Because you don't want to, for example, like lie in bed and be thinking about scrolling through your phone, or, doing your work or anything like that. So just reserve, if you need to do anything else, like leave the room, go do it, and then come back and just like focus on sleep. So those are just some like easy things that you can do to implement. But if you don't have time to go through all of these tactics from your patients, I always say like the simplest thing you can do is just to make sleep a priority. So sleep shouldn't be something that happens at the end of the day when everything else is done in your life. You should actually be stopping everything else that you're doing in order to get that good sleep. So if like in a nutshell, if you say nothing else to your patients, that's like, one thing that you could give them.
So we shouldn't wait until we're dead to catch up on our
Exactly.
sleep.
Exactly. That's exactly right.
We shouldn't prioritize the hustle, as my friend Bucci said, like, for the good sleep. We should
Oh
really
my
make sure
gosh,
that we
yeah,
make it a
yeah.
priority. I love that.
That's
And all of us who have teenagers out there need to set these good habits early in our kiddos too. Otherwise, we're going to be setting this next generation up for failure too. So
Totally,
I think
totally. Couldn't
anybody who
agree
hears
more.
this podcast hopefully can learn more themselves about sleep and can help bring really good habits to their own families, to their own communities, to the next generation, et cetera. So, Dr.
Sure, I
Bhutani,
love
thank you so much. You are always just such a ray of sunshine and such an inspiration, and we always learn so much from you. We are so incredibly grateful that you were able to be with us today.
This was
Thank you
amazing.
for
Thank you so
having
much.
me. Thank you.
Thanks for tuning in to SkinSync. Don't forget to subscribe to SkinSync on Spotify or Apple Podcasts so you never miss an episode. To explore more of Elevate's educational and career resources, visit elevate-derm.com. Please note, this podcast is for informational purposes only and not a substitute for professional medical advice. Always consult a licensed healthcare provider before making medical decisions. Clinicians must rely on their own judgment and training in all patient care situations.